My name is Julie Carter. I'm a nurse practitioner and professor of neurology at Oregon Health and Science University. Our article describes an interdisciplinary palliative care model for Parkinsonism called the Next Step Clinic. The tenets of palliative care, the relief of physical, emotional, spiritual, and psychological suffering, are really best done by an interdisciplinary team. The team listens carefully to the patient and family and together constructs a joint plan of care which focuses on quality of life. As a neurology provider, my role is to do the initial evaluation of patient and family. In the patient, complex symptom management is dominated by non-motor problems. The caregiver is assessed for strain and the ability to manage the caregiver role. Intervention is dictated by the needs of the patient and family and disease severity. A discussion of future planning and advanced directives is also initiated. All of these assessments are complemented by our social worker.
I'm Tony Borsich, social worker. The Next Step Clinic is especially conducive to social work. First, family, caregivers, and friends are encouraged to attend, and many often do. Second, the social worker teams with the neurology practitioner. Third, team members conference prior to giving suggestions and findings to the patient. These aspects create and advance a multifaceted narrative presented not only by the person with Parkinson's, but by family, friends, and caregivers as well. And now, our physical therapist.
My name is Jennifer Wilhelm, and I'm a physical therapist at Oregon Health and Science University and part of the Next Step Clinic. I think the role of the physical therapist in the Parkinson's Palliative Clinic includes helping the patient as well as the family with their current needs. This may include pain management, including dystonia or rigidity, mobility training, including determining the appropriate assistive equipment and training in use, and collaborative approaches with the neurologist for non-motor symptoms such as orthostatic hypotension and incontinence to maximize the quality of life. We of course do this in conjunction with our speech therapist.
My name is Linda Bryans, and I'm a speech and language pathologist at the Northwest Clinic for Voice and Swallowing in Oregon Health and Science University. My role on the palliative care team is to evaluate the patient's communication skills and swallowing abilities, and to evaluate the impact of these challenges on daily function, social interaction, and social participation. The assessment of swallowing may be complemented by a discussion with a neurology provider regarding the patient's wishes for non-oral feedings if indicated. My recommendations for further evaluation and treatment of specific areas of concern are guided by the patient's and the family's priorities.
My name is Lisa Mann. I'm a registered nurse at the OHSU Parkinson Center. As a nurse, my role in the Next Step Clinic is to ensure clinic flow and ongoing communication with the patient and caregiver. Nurses are trained in disease management, to be sure, but they are also taught to be educators, patient and family advocates, medical provider liaisons, and team care managers. Given the complexity of advanced Parkinson's disease, the need to treat both the patient and caregiver, as well as coordinating a plan developed by 5 different healthcare providers, the nursing role is vital in maximizing the benefit of this interdisciplinary model for the patient and family. As you can see, advanced stage Parkinson's disease and Parkinson-plus patients may be well served by an interdisciplinary model. As described in this article, the Next Step Clinic's model of integrated care through Parkinson's disease specialists in neurology, physical therapy, speech therapy, social work, and nursing is best suited to address the complex late-stage motor symptoms, non-motor symptoms, and quality of life goals of both the patient and the caregiver.